Hi, in this video we will be discussing about cephalosporins. Cephalosporins are one of the beta-lactam antibiotics. Hence, it consists of a beta-lactam ring that is fused to a dihydrothiosin ring. Plus, there are these side chains which are attached to the beta-lactam ring and the dihydrothiosin ring. By addition of these various side chains, we have been able to produce a wide range of cephalosporins which have different pharmacokinetic and antibacterial activity. Now, coming to mechanism of action, it is similar to penicillins, that is, it inhibits bacterial cell wall synthesis, and hence they are bactericidal. Now, moving on to mechanism of antibiotic resistance, it is similar to penicillins. So there are mainly three ways by which bacteria develops resistance against cephalosporins. So the first one is that bacteria produces enzymes called beta-lactamases. They hydrolyze the beta-lactam ring of cephalosporins. The structural integrity of beta-lactam ring is very important for the antibiotic to function. So when the beta-lactam ring gets destroyed, then the antibiotic can no longer function and hence is inactivated. The beta-lactamases that hydrolyze cephalosporins are called cephalosporinases. However, an important point to note is that cephalosporins are still more resistant to beta-lactamases than penicillins. Bacteria can alter the antimicrobial targets. For example, here we've got the penicillin binding protein. Normally, cephalosporins, they bind to these penicillin binding proteins and hence inhibit the cell wall synthesis. But bacteria can alter their structure so that the drugs can no longer bind to these newly altered penicillin binding proteins and hence it can't function. And finally, bacteria can also reduce permeability to drugs. So these are the ways how bacteria can develop resistance to cephalosporins. Based on their antimicrobial spectrum, cephalosporins can be divided into 5 generations. The first generation is primarily active against gram-positive bacteria and limited against the gram-negative organisms. Subsequent generations have increased activity against gram-negative bacteria and are limited against gram-positive bacteria. Organisms not covered by first to fourth generation cephalosporins can be represented by a mnemonic called LAME, which stands for Listeria, atypicals, that includes Mycoplasma, Chlamydia, MRSA, and Enterococci. Now let's look at the first generation cephalosporins. They're highly active against gram-positive bacteria. They're also active against a few gram-negative bacilli, which includes Proteus, E. coli, and Klebsiella, which can be represented by the mnemonic PEC. And it also has some anaerobic coverage, except Bacteroides fragilis. The important drugs that come under this generation includes cefalexin. It's given orally. It is used for cellulitis or soft tissue infections and also in uncomplicated urinary tract infections. The other important drug is cefazolin. It is given IV and it is the drug of choice for surgical prophylaxis to prevent staphylococcal wound infections. And the other drugs include cefadroxil and cefradin. Now moving on to second generation cephalosporins. They have similar activity against gram-positive cocci, but they've got an increased activity against gram-negative bacteria, which includes Haemophilus influenzae, Enterobacter, Neisseria, and Serratia. Plus, the usual Proteus, E. coli, and Klebsiella, which is similar to the first generation. And here you can use the mnemonic hence PEC to memorize these bacterial coverage. It also has this anaerobic coverage, and the drug cefotitan also covers for Bacteroides fragilis. And the drugs that come under second generation cephalosporins include cefprozil, cefuroxime, which is sometimes used to treat community-acquired pneumonia. Then we've got cefotitan, which is used to treat intra-abdominal infections, peritonitis, diverticulitis, and pelvic inflammatory diseases. Then we've got cefoxitin, which is used for surgical prophylaxis of infections caused mainly by gram-negative bacteria. And these drugs do not enter central nervous system except cefuroxime. Then moving on to the third generation cephalosporins. They have weaker gram-positive coverage compared to the first generation. However, they have got a greater activity against a wide range of gram-negative organisms, which includes the Enterobacteriaceae, Neisseria, and Haemophilus influenzae. And the drugs that comes under the third generation cephalosporins include ceftriaxone. This is one of the most common drugs used in clinical practice. The others include cefotaxime, ceftazidime. This is the only agent in the third generation that is active against Pseudomonas aeruginosa. And lastly, we have cefpodoxime. And these third generation cephalosporins are mainly used in treatment of serious infections such as sepsis, also used in meningitis, gonorrhea, and treatment of advanced Lyme disease. Most of the third generation cephalosporins enter central nervous system. Then moving on to fourth generation cephalosporins, they have antimicrobial spectrum similar to third generation drugs. That is, they've got weak gram-positive coverage, but they've got good activity against MSSA and Streptococcus pneumoniae. They've got greater gram-negative coverage and have got good activity against Enterobacteriaceae and Pseudomonas aeruginosa. And they're also more resistant to some beta-lactamases. And the drug that comes under fourth generation cephalosporin include cefepime. It is used in the treatment of intra-abdominal and urinary tract infections and also pneumonia. Now we've got fifth generation cephalosporins. It has got broad gram-positive and gram-negative coverage. Unlike first to fourth generation cephalosporins, these fifth generation drugs are effective against MRSA, Streptococcus pneumoniae, that is resistant to penicillin or ceftriaxone. However, they do not cover Pseudomonas. The drug that comes under fifth generation cephalosporin is ceftaroline. It is used for skin and soft tissue infections and also for community-acquired pneumonia. Now let's look at the pharmacokinetics. Absorption. Oral cephalosporins are well absorbed from gut and food does not interfere with absorption. Distribution. They're widely distributed into bone, soft tissue, pleural, pericardial, and peritoneal fluids. Most third and fourth generation cephalosporins enter central nervous system. Excretion, it occurs by tubular secretion, whereas ceftriaxone is mainly excreted in bile. Hence, no dose adjustment is required for renal impairment. Now, coming to adverse effects, it can cause gastrointestinal upset, that is nausea, vomiting. It can also cause allergic reactions similar to penicillins. Skin reactions such as urticarial rash and pruritus are common. There can also be cross-reaction between penicillin and cephalosporin, which is around 5 to 15%. So whenever there's a history of serious reaction or anaphylaxis to penicillins, cephalosporin should not be used in these cases. It can cause Clostridium difficile diarrhea, especially with broad-spectrum cephalosporins. It can occasionally cause autoimmune hemolytic anemia, disulfiram-like reaction, and sometimes bleeding due to hypoprothrombinaemia. So this concludes our discussion about cephalosporins. Thank you.